it was emotionally draining because like I'd gone from a completely normal life to something just happened and I ran into this problem and nobody seemed to have a solution for it. Hi, my name is Chris Check and I'm a patient of Dr. Elkwood's and Usal. I had a series of symptoms over the last 7 years that made it very difficult for me to sit down without experiencing tremendous amount of pain. No doctor could figure out how to make a diagnosis on this. And the pain was in my pelvic area. So it was just very painful. I went for over a year of pelvic floor physical therapy before my therapist finally just said, I've done all I can do. I want you to go see Dr. Elkwood at the Plastic Surgery Center. Finally got to somebody who understood what I was going through. Had seen other patients like this. After a series of trial runs to make sure that we had the right nerve or he had the right nerve, we proceeded with going to surgery. As far as emotions leading up to the surgery, it was challenging. I was on disability for work for 4 or 5 months. I couldn't sit. I sit in a car for a living. It was emotionally draining because like I'd gone from a completely normal life to something just happened and I ran into this problem and nobody seemed to have a solution for it. So it was difficult. I mean, it's just like couldn't figure out why this would be happening. But after surgery, it was quick. I mean, I stayed in the hospital the first night of my first surgery, but I was up and walking around the hospital that night. After this most recent surgery that I had, it was fine. I mean, I had very little pain at all. I did physical therapy afterwards, working to try to break up some of the scar tissue. The pain was minimal at most. As far as the staff there at the Plastic Surgery Center, everybody's great. I mean, they coordinate surgery. The nurse is in touch with you. Surgery center will call back and check on you after surgery, make sure everything's okay, that there's no issues. There's quick follow-up post-surgery to make sure that everything's healing right and everything's good. So I had no questions there, no problems with that. It's been 3 months since my surgery. I don't have any nerve pain now, still working on breaking up some of the scar tissue from it. It's good not to have any nerve pain. I'm doing some PT now. Things are going well. I'm very happy. And what advice would I give someone that's considering surgery? I mean, I'm not somebody who's afraid of surgery. And the fact that Dr. Elkwood is a, kind of world-renowned surgeon makes it a little easier to go into that surgery. I have utmost confidence in him and Dr. Usal. They did a great job. I'm very happy and looking forward to just a full recovery and being able to go back and live a normal life again.